All right, and we should be live. Hi, everyone, and welcome back to another session with DentalShadowers. Today, we're joined by Dr. Austin, and we'll be talking about restorative and cosmetic dentistry. Doctor, thanks so much for taking the time out of your busy schedule to connect with us. Please feel free to take it away whenever you're ready.
Thank you so much for having me. I hope we get to have a little fun tonight. And so I thought I'd kick off by showing this little video, which is one of the highlights of my professional career. So enjoy, and I'll explain this later.
Awesome.
This next Jumbotron,
so stoked.
it is unbelievable.
Griffin, I want you to read it.
Are you sure?
Hometown boy, I think you deserve this.
I do not live in San Antonio, though, right?
You're confused because of the name? Please,
yes,
Griffin,
yes,
read the name.
The name is Joshua Austin. Okay, so I can kind of understand. So, Mabim Bambinos, who live in the San Antonio area, there's a hyperlink that we desperately need you to go to. If you live in San Antonio and you listen to our podcast and I find out that you didn't go to this hyperlink, I will be so peeved. It's www.joshuaaustindds.com. Mabim Bambinos in the San Antonio area. You need a good dentist. Check out www.joshuaaustindds.com for a dentist that vibes it and keeps it tight. This is a dentist. This is a tooth doctor with tools and instruments and everything that's going to get into that mouth, close to the nerves, and you're going to know exactly what kind of righteous alt comedy that they are into. Is there anything better than that?
Let me tell you about Joshua Austin. Was his dad a dentist? He was. You can't buy that sort of thing. You have to inherit this level of dentistry. Joshua Austin was named a super dentist by Texas Monthly in 2014, 2015, 2016, and that's all we know. So maybe last year didn't quite nail it down. A light year for super dentistry from Josh. That's why he needs you now more than ever.
Oh, last year he won Evil Dentist. But he's bringing it back.
San Antonio's best evil dentist is Joshua Austin. Catch him.
Just some stuff I can say about Joshua just by looking at the JPEGs on his website. One, he does own a very powerful, handsome jacket, and I can confirm, a nice watch. I bet he takes that off, though, before he gets a knuckle deep in the chompers to find all the nasty holes that have the food tucked away inside of them. Other things I know about him. I mean, the smile, it's on point.
It's winning.
It's radiating something, and you're gonna like that. You're gonna see these teeth and know that you're in good mouth.
So go to joshuaaustindds.com now. I
feel like Joshua has broken the seal now of dentists knowing that they can now get advertisements on our show. When are we going to have the perfect all-dentist promotional spot that's just us talking about some of our favorite dentists?
I think we should do a special episode.
Just for dentists?
They all got to pay, though. They're all going to pay.
Oh, he's a human dentist for humans, by the way. We didn't specify he's not for, dogs and horses and stuff.
So that's a segment from my favorite podcast, which is called My Brother, and Me. Some of you may have heard of it. Those three brothers also do a podcast called The Adventure Zone, which is very popular. And they used to do a deal where they would do ads on their show for $99, and you just had to get in on time to submit one. And one day I got one in and I didn't know what to type. So I just put, you need a dentist that vibes it and keeps it tight, thinking that was kind of funny. And they thought it was really funny. And so they went with it. So that's what that's from. And it turns out there's a whole underground community of people who animate those bits from My Brother, and Me and put them on YouTube. And so one of the animators reached out to me and was like, hey, I'd really like to animate this if you would let me. And so that's who did that. And so that video that he posted on YouTube has something like 300,000 views on it, which, I've always tried to make something that like had some sort of viral outreach or whatever, and obviously never happened. And then that's the thing that does. But if you've never heard My Brother, and Me, it's three brothers that it's an advice show, and they specifically give pretty bad advice. They do a lot of like questions from Yahoo Answers and stuff like that. And it's always just like weird situational things that happen to people. And that's kind of their comedy. They just riff off each other and they're really good. So check out My Brother, Me. That particular episode, I think was episode 413, which was a couple years ago now. But as the video said, my dad was a dentist and this is my dad. You can see here, and he practiced for 25 years in Amarillo, Texas, which is in the panhandle of Texas. And not long ago, I actually found a whole notebook of photos of my dad's office. And so I just like going through them because they're fun to look at these pictures of an old dental office. And here's their building, the Amarillo Dental Building. 5-doctor group practice that opened in 1972. 5-doctor group practices now are no big deal. You see this everywhere. Every city, every town has one, and bigger ones than that. And so not a big deal today, but in 1972, it actually was a really big deal. And when this office opened, they were the biggest group practice west of the Mississippi. And so I'm proud of my dad for sort of having the foresight to see the writing on the wall that group practice is a effective practice model and a desirable practice model, and decide to do that when no one else was doing that. Everyone else was just a solo practitioner at the time. So the building still exists, although it's not a dental office anymore. It's now the Clear Channel Communications TV studio for the city of Amarillo, Texas. So not a dental office, but it still stands. Here's the waiting room. And, you just look at this and you're obviously in awe of this beautiful modern aesthetic design that they've chosen for the interior of this office. It's the most 70s thing I've ever seen in my life. It literally could not get any more 70s than this. Look at that front desk. There's not a computer screen to be found anywhere on that front desk, which is kind of wild because today, like every room in a dental office has more than one screen in it, and this office has none. The decor is great. Here's a view from the other side of the waiting room, which is ostensibly in another zip code because of how big this waiting room is. You could play a full court NBA basketball game in this waiting room. It is so big. And in the days of COVID, where most of us aren't really using our waiting rooms at all and having people wait in their cars, this just seems like a whole heck of a lot of wasted space. But, it was 5 doctors, so I guess you needed a good amount of space for a reception area. This is my second favorite photo of the entire series. This is my dad's office manager, Georgia. And Georgia was the epitome of a sassy Southern woman. She sounded a lot like a character from a movie called 9 to 5 that was played by Dolly Parton. And she just had like these sassy Southern sayings like kiss my grits and stuff like that. Like she would say that stuff unironically. That was just like part of her vernacular. She had this beehive haircut from 1962 until the day she died in 2002. And she was, I can just hear her voice in my head as I look at this photo. And if you look behind there, behind her back, you can see that's the appointment book, which was actually a book that they actually wrote down in, which is just wild to think about looking back on it today. And then, of course, just, the miles and miles of charts. And, at least my office now is paperless and doesn't have charts. And so, that's, it's wild to look at. And I do, every time I look at these photos, I see something new. I don't know who this woman is back behind Georgia there, but I do know my dad used to tell me all the time, and I quote, if you've got time to lean, you got time to clean. And this lady's leaning on the job. I feel like she should be at least dusting something, wiping something down. I mean, if my dad was that strict on me about it, why wasn't he cracking the whip on her? This is the other office manager, Debbie. Say what you will about Georgia being stuck in the 60s. Debbie in 1974 here is ready for the 80s with that permed haircut and those cut off sleeves. She is ready for Def Leppard to pour some sugar on her. This is something I don't have in my office. This is a library with a wall of textbooks and journals. That thing on the back, it looks like a computer, is not a computer. That's actually something called microfiche. You may find microfiche at an old library today. You probably have never experienced microfiche, but it's how they used to keep like old journal articles archived. It was like these little, like basically negatives, and you would put them on that deal, and it was, a whole year's worth of an entire journal, and it would magnify it up to where it was readable. Again, every time I look at these pictures, I find something new. A couple of weeks ago, I looked at the end of that table and noticed something I hadn't seen there before, which was an ashtray in the middle of a dental office which isn't quite surprising when we think of this next photo. This next photo on the architectural plans of this office says, and I quote, "smoke and coffee break room." And that's what obviously this room was used for. It's wild to me that in this, as far back as or as recently as the 70s, that people used to just smoke in a dental office all the time. No big deal. And you could see the ashtrays full of cigarette butts. You got, I don't know, whoever this woman is here on her break with her pack of Virginia Slims and a cup of coffee. And, you know, you have a tough extraction on number 3 and you just go and blow a heater in the smoke and coffee break room in the middle of a day. It's just wild to me. I love the wallpaper in this room. Nothing like taking a very small room, putting a very loud wallpaper in it, and then throwing a mirror in it to make it feel like you're in a circus funhouse. Add that into all the smoke, and I'm sure this was just a cracking place to be back in 1974. This is one of the operatories, and I just love everything about it. I love the chocolate brown delivery system, the chair, and the place where all the hand pieces are and all that. I love the fact that there's a phone inexplicably right by the patient's head when they're reclined. I don't know who the phone is for, if it's for the patient or if it's for my dad. I don't know who's taking a phone call during this. And I, more than anything, I just love the red carpet because you're extracting a tooth and you drop your extracted tooth on the red carpet. You just kick it off to the side and it's no big deal. No harm, no foul. That furniture, that delivery system does come in red too. So when you guys are looking at opening your office, you do have options if you decided to go with this particular delivery system. I haven't seen the catalog for this delivery system, but in 1974, I think it's safe to assume that it came in another color besides chocolate brown and I don't know, blood clot red. I'm fairly certain that it came in avocado green, but we can't put avocado green on red carpet. This place is classy. We have a little taste here. So I just love that. And this next picture is my favorite picture of the whole series. This is my dad. And I just wish I knew whoever took this picture, what they asked him or said to him before this picture was taken. The only thing I can imagine is he's asking the architect, who the hell picked red carpet? Because I can't look at that photo and not think of this. This is a scene from the movie The Shining, which if you haven't seen before, you really need to see. If you just see a long hallway of red, you just can't help but think about the bloody hallway in The Shining. And it's just my favorite picture. I just love everything about this picture. And I just wonder what the hell they were thinking, because it's just wild. It's wild to think about that much red carpet and to think that at some point was a good idea. And people thought, wow, this place is nice. Never again will anybody ever think a place with a long hallway of red carpet is nice. So a little bit about me. I graduated dental school in 2006 from UT Health here in San Antonio. In 2009, I opened my own startup practice. So for 3 years, I worked as an associate in a couple other practices around the city and kind of learned some stuff, learned a little bit more about dentistry, learned a little bit more about business. And 3 years after graduating, I opened my own place in San Antonio, Texas. As you can see here, I'm still in that same building today. And then in 2014, I think it was, I got, I guess, a job or appointed or whatever you want to say, as a monthly columnist and editorial director of the dental magazine, Dental Economics, the longest consecutive running dental magazine. We go back to 1917 is when we started publishing. And when we started distributing and been continuously running ever since, minus a couple years in World War II, where we didn't send out any issues. I think in 40 and 41 or 41 and 42. And I'm on a team of 4 other dentists who are all pretty young and looking to sort of move this publication. And I think we have moved over the last 5 years this publication from an older type publication to fresher publication with a lot of new content, a lot of stuff on digital, a lot of stuff on digital marketing, internet marketing, digital practice stuff. And so, I feel good about being on this team, and it's a big part of what I do. And I'm really happy. There's no other publication I would rather be associated with than Dental Economics. It's, in my opinion, One of the most practical and one of the most, real life journals that you can get that actually gives you information that you can use right away. Yeah, we certainly need scientific journals that talk about, systematic reviews and meta-analysis of using chlorhexidine mouthwash in implant surgeries, whatever topic it may be. Stuff's all fine. But a lot of times what comes up in those scientific journal articles takes a few years to make it into practice. And so, I feel like we're putting out stuff that dentists can use right away in their practice and not have to, wait for years to come up. And so that's great. My column is a product review column, which is great because anytime a company comes out with a new composite or adhesive or cement or a new digital scanner or 3D printer, they send it to me and I get to play with it. And so I've gotten to have my hands on a lot of things around dentistry, a lot of new products and whatnot, more so than the average dentist would have. And so I feel like it gives me a little bit of an insight into the industry and what's coming up and what's, what are the trends of dental materials and technology as those things evolve. So one, thing about my column is I won't write about it unless I've used it. And so this column was written for many years by somebody who didn't practice dentistry. And then I took it over from them in 2014. And so, I just don't know how somebody who isn't a practicing dentist writes about dental composite. Like, how do you know how it handles? How do you know how it feels? How do you know how it polishes? If you haven't used it on a patient. And so that's kind of my vow to everybody who reads my column is, hey, if you see me write about it, it's because I've used it. And so it's a big part of what I do. And I enjoy it. I also do a lot of lecturing. A lot of it because of the dental economics thing. When you have that position of the author of the Pearls for Your Practice column, it comes with a lot of opportunities to speak to dentists about what are the new techniques, technologies, materials out there. People want those updates all the time. And so I do a lot of lectures like that. I have other topics that I do as well, but that's just one of them that I do. Here's a picture of me on the main stage at Dentsply Sirona World in 2017. So Dentsply Sirona World is kind of the biggest meeting in all of dentistry. At their main stage, at their general session, they have about 8,000 people or so usually every year. And so in 2017, I got to do a 20-minute set in front of that whole group of 8,000 people. And kind of one of those crazy moments of your life where you're, in the green room back before, getting ready, and you'll see the camera and it's like in the theater that Mariah Carey plays at the Venetian, and it's just like wild. It's you go out there, and fortunately the lights are such that you can only see the first few rows, which is good. And then you do your deal, and it's one of those memories that will stick with me forever. And then obviously done a lot more since then. You get on that stage, and it kind of stuff starts coming in. Offers start coming in. 2017, 2018, I started a podcast called The Working Interferences with my friend Lance Timmerman, who practices in Seattle. The point of our podcast, Working Interferences, there's a ton of dental podcasts. If you've never looked, there's a million of them. And they all attempt to offer some kind of either clinical or practice management content of some sort. And we make no promises. We're the world's only dental comedy podcast. And so we do a lot of like what my brother and me does, but for dentistry. So we pull a lot of dumb questions off the dentistry subreddit, and read those and make fun of various people. It's a good time. If you listen to podcasts, just search for Working Interferences. You'll find it. iTunes, Google Play, Stitcher, Spotify, Podbean, any of those places where you can find podcasts, we will be there. And it's fun. It's not super heavy content in any one way or another. And I think I put on my list of about me that I survived 2020. I did not die in 2020. It did leave me feeling a little bit like Bo Burnham from Inside. If you've had a chance to watch that, if you haven't had a chance to watch that, I highly recommend it. And just sort of like Bo Burnham spent his, time in quarantine and lockdown, making some content. I sort of did the same and in the same kind of vein, but not nearly as well done as Bo's. And I came up with this 90-minute talk on mental health for dentists and the importance that therapy's had on my journey in dentistry. And dentistry's hard, and it's hard physically, it's hard emotionally. And there are days that no matter how experienced you are, You don't feel like a good dentist. There's days that you feel amazing and like you own the world. And it's a roller coaster. And there's days you feel like you can't do anything right. There's days you feel like you can do everything right. And so, this is one of those that at some point, I think everyone's going to have some tough times in this profession. That doesn't mean it's not great. I think every great profession offers challenges like that. If every day were easy, it would be selling ice cream, and nobody's going to make a great living or have spiritual contentment from doing that. And so if that ever interests you in hearing about the importance of things like therapy and yoga and meditation on your mental health as a dental student, as a dentist, you can check this out, bit.ly/dental mental health. I think it costs $30 for the course. I get none of that money. I've already gotten paid by these people. So this is just, if you want to watch it on demand on the CE Zoom place, you can. bit.ly/dental mental health. It's kind of my version of Inside, I guess, but a much, much less talented one. Although I released mine before Bo released his. It's a lot like stand-up comedy. And so you'll see a lot of that in it. So it's not just a heavy downer all the time. So check that out if you are interested in that. So let's talk about my practice just for a second. I know that I was talking with the moderators here before, and for some reason I put down that I'm an orthodontist. I'm absolutely not an orthodontist. I'm a restorative and cosmetic dentist, and I've spent most of my time lecturing, making fun of orthodontists, because orthodontists, they really have the cushiest job of all dentists. They go around and they look around like that and they say it looks good. An assistant does the rest of their work and they move on to the next person, and they charge a patient like $7,000. And the patient happily pays it, and everyone's happy. That's I love to crack on orthodontists because they've obviously cracked the code, and I'm here sweating it out, digging deep decay out of interproximals, and they're laughing at me counting their money. So I get to make fun of them every once in a while. I opened my practice, like I said, in 2009. So before that, I worked as an associate in a couple of dental practices, kind of all over the board, really nice high-end practices, working collar practices, emergency extraction clinics, things like that in between. It's a solo practice, so I'm the only doctor there. At some point, that's probably going to change. With me being out of the office to lecture, it would make sense for me to have somebody else there. So at some point, that will happen. I have 10 employees. Of that breakdown, 3 of them are admin staff, including my office manager, but I have 4 hygienists, and they are all part-time. And so that's kind of something that happens with dental hygienists. I'm not trying to be sort of gender negative with this, but just by and large, hygienists are women. And generally speaking, women get into dental hygiene, and then they work full-time for a few years, and they start to have a family, and they start cutting back after they have a family. So all 4 of my hygienists are part-time. They pretty much all started full-time and then had families and started cutting back. So I'd have to add another one to make up for the time that they started cutting back. So that's something you're probably going to run into in dentistry, especially if you're a general restorative dentist or a prosthodontist and you employ hygienists. You'll find that, typically speaking, they don't work full-time, and that's just part of the deal. And then then I have me, the 3 business side employees, the 4 hygienists, and then a couple of dental assistants, and then obviously me. And so we hum it pretty good all day, kind of running fast, running hard, keeping every room filled, me bouncing back and forth between all of them. Kind of hectic days, but really I'd have it no other way. That's just the way that I kind of run and the way that I like it. And for some people that's great. For other people, it's not. It just kind of depends on what you like. And I like it being fast paced. I like it being, full and going all the time. I can sit around at home, and I don't want to be at my office and sit around. So, that's typically the way I do it. And I took some pretty extensive Invisalign courses in 2021, and I'm really looking at integrating that more and more into my practice because I think that is really, I think the 2000s, 2000s through 2020, that sort of couple of decades was really the implant era. And that's when implants kind of became part of regular practice all the time. And they went from being something you saw every once in a while to something you see, routinely, treatment plan routinely, perform routinely, restore routinely. I think that's the next phase of dentistry is clear aligners. And I think clear aligners becoming more integrated into everybody's practice is probably the next generation of dentistry and being a part of a lot of our treatment plans, partly because patients want it. Patients are open to it and are willing to do it. They know about it. because of Invisalign marketing and different things. And so I think that's going to start becoming more and more ubiquitous. And I think general dentists are just going to have to get good at Invisalign. I think the problem is that Invisalign training is not very good. And so to get onboarded with Invisalign, you don't learn very much and you don't learn the right information. And so it really takes going to a really high level course to learn this stuff and to learn really how to do it well. And so if at any point you guys are interested in more of that, ping me anywhere on social and I can kind of point you in the direction of what kind of courses to take for this, because it really does make a huge difference in your success in how well you're going to perform, how confident you're going to be, which then translates to how many cases you do. If you're not confident in it, you're not going to do a lot of cases. And so this has really sort of changed the game for me. And you're not going to learn it in dental school. It's going to be something you got to learn outside of dental school. There's just not really any dental school that's going to teach you orthodontics at all. It's always been sort of the private little club that only residents get to learn, ortho residents get to learn. And so Invisalign is even more of that. It's just not going to happen in a typical dental school. And so, that's something you're going to have to really focus on when you get out of school, if you are interested in doing that. If not, that's fine. Refer to your orthodontist or whatever. But I think that's going to get to be more and more ubiquitous as time goes on. I think when I think about digital dentistry, I do know that a lot of dental schools now have a digital dentistry department, and it's a part of a lot of the curriculum. And I think that's great. But I think the problem is I don't necessarily think they're teaching students about using it for the right things. I think they're using it for some of the right things, but I don't think they're using it for the most important thing. And so, you guys all recognize this, right? Every one of you have one of these. A lot of you are probably on it right now. If I know your generation, I know some of you are probably born with one of these in your hand as you exited the birth canal. An iPhone, right? And when I think about, I don't know, probably 2007 was when the first iPhone came out. You guys were probably in elementary school at that time. But I thought I was buying a phone. I thought I was buying a cell phone, and I did. Technically it was a phone. But in 2021, I think we all understand what this device really is. It's become the digital hub of our lives. It's our connection to our friends, our loved ones, pimple popping videos. The iPhone's great technology. The Android is great technology. It's put the world at our fingertips. As Bo Burnham says, it is anything and everything all of the time. And that's the thing about great technology, is that it integrates itself into your life so much that you literally cannot imagine living life without it, because it makes so many things you do faster, easier, and better. Faster, easier, and better. Aren't these goals that we should all have for our dental practices? So what's the iPhone of dentistry? Is there an iPhone? What will allow us to see more, do more, and do it better? Isn't that how our patients want to be treated? When most dentists ask me about an iTero, which is the digital technology that I use in my practice, they generally refer to it as the quote unquote Invisalign scanner. And while its Invisalign workflows are exquisite, just like the iPhone, it does so much more. It is far from just being an orthodontic scanner. It's really a treatment plan acceptance machine. And that's all because of this, the iTero-driven new patient experience. And so I've been in the digital dentistry game for about 8-10 years, somewhere in there. And this isn't the first scanner I've had. This isn't the last scanner I've had. But the first scanner that I had, simply all it did in my practice was replace impression material for some procedures. And while that's cool, it didn't change my practice. It didn't make my practice, it didn't move my practice closer to the goal that I wanted to have, which was patients making decisions based on their treatment needs, not their insurance, patients making decisions based on their needs, not finances, and patients fully understanding what we can do for them. And so when I figured out that this machine was best used for the new patient experience is when my practice changed. And so these machines have been around for about 10 years. This is the original iTero, back before it was owned by Align, which is the company that owns Invisalign. When the Cadent sales rep would come to your office and try to sell this to you, they would say that it eliminates the cost of PVS. That's polyvinyl siloxane impression material. That's the impression material you would use for a crown or a bridge or an implant or for Invisalign. That you eliminate the cost of that impression material, that you reduce the time that it takes to deliver a crown. At some point when Align bought Cadent, it was, all right, make your Invisalign workflow a little bit easier. But at the end of the day, it was still just a replacement for impression material. And just being a replacement for impression material does not change your practice. It is simply then just a substitute for impression material. It is not any different. It does not change the way that your practice is fundamentally. The new value proposition, when you buy one of these scanners now, to me, I think the new value proposition is that this type of technology, this digital scanning technology, if you base your new patient visit around it, your new patient experience, and I use that word pretty specifically, we'll talk about that more in a little bit, it gets people to say yes to treatment because they can see what you're talking about. And when they can see what you're talking about, they understand what you're talking about. And when they understand what you're talking about, they are way more likely to say yes to treatment. If you just tell them they need 3 crowns and 4 fillings and don't really review this kind of stuff with them and help them understand why they need that, when they get to the front desk and it's time to make an appointment and they see their estimate on what their out-of-pocket is, if they don't fully understand why they need that, do you think they're going to say yes to it? And I can just tell you from experience, most of the time the answer is no. It becomes about finances at that point. But if you can help them understand why they need this, why they need whatever treatment, using a visual aid like a 3D scan, it changes the game. It changes the game. You no longer have to worry about, do they believe you? Do they think you're a liar? Are you just trying to make your car payment? Anything like that. No, because you've shown them the broken tooth. You've shown them the decay. You've shown them the abscess, whatever it is, on the scanner in 3D in a beautiful 28-inch high-definition monitor on a touchscreen where you can zoom in and zoom out with all the bells and whistles that are there. They fully understand the treatment that you've presented, which means they are way more likely to say yes. This helps patients say yes to Invisalign far more often than without, partly because at least the iTero, which is owned by Align, has something called an Invisalign outcome simulator, where it can basically show people what Invisalign can do for their teeth, how it, what it looks like now, what it would look like, or what their teeth would look like after Invisalign. And that's incredibly powerful in getting a patient to say yes. I've had patients who had no interest in Invisalign before we started the simulator. We do the simulator, it takes about 90 seconds to do. And by the time they see that, they're actually interested in Invisalign and, oftentimes say yes to treatment, or at least will say yes to treatment at some point. So it's all about treatment plan acceptance. It becomes a part of the patient record. Once you scan this data, it lives in a cloud. It's there forever. So if for any reason that data needs to be retrieved, whether it be for record keeping, whether it be for, some sort of future treatment, and you need to know where the patient is at, on this particular day, that data is evergreen in a cloud. It will never go away. You don't have to worry about losing a chart or losing a flash drive or, having an attachment get deleted or anything like that. Yeah, it absolutely does all the things that we bought it to do originally. It eliminates the cost of impression material. It reduces the time that it takes for crowns to be put in because of how accurate it is. And it decreases the number of times you need to have a crown remade because of something not being right, because of the accuracy, right? And so it does do all those things, but it's really the first couple things that are the important things. Those are the things that change your practice. Just simply substituting an impression material does not change your practice, but this does. If you start scanning your patient at their new patient visit, it changes the ballgame. It changes the ballgame because they are much more likely to say yes to treatment, which is what you want. So I get a number of people who come in for a second opinion. And by and large, when I ask those people, they'll come to me with a treatment plan that another dentist gave them, and it's almost always expensive treatment. They need a few crowns, an implant, whatever. I asked them, did they show you any imagery? Did they show you photos? Did they show you x-rays? and usually say, no, they just showed me the sheet of paper that said how much it was going to be. And so no wonder there's a disconnect, right? No wonder there's some leeriness there of what's happening in their mouth, and throw that on top of, every, New York Times story about dentists overtreating, on top of every other negative news story there is about dentists. And, you get why people don't trust you, and they probably don't trust you from the minute they walk in. And so when you incorporate this technology in to their new patient visit, it just changes the ball game. It just makes them trust you and understand where they're at. And it makes them much more likely to say yes to treatment, which is the goal, right? That's what we want to do. The other thing it does is it allows us to track problems that we've never been able to track before at a level of accuracy we've never been able to track before. So we deal with gum recession on patients all of the time. And generally speaking, we kind of have to measure it by a periodontal probe. And the human eye can really discern between 0.5 and 1 millimeter at a time. And that's not very exact. And add that to the fact that if you take this different hygienists and you measure the same recession defect, one of those hygienists is going to be off in their measurement. So if you take 5 hygienists, one of them will be off in their measurement because humans are involved. And so that means there's always going to be error. And so when you start scanning patients at their new patient visit, you can then scan them again at their subsequent visits and compare the 2 scans and see what's changed. So for instance, you see here, we had a scan done on 10/9/2019. If you look on that right-hand side, and then here you can see 2/8/21, and you can see the change between the two. And when you do this clinically, it will actually create like a GIF or a GIF, whatever you want to call it here, just like this, to show the patient what's changed in their mouth in this specific area. You see that red line there with the circle around it. And then it will show them this GIF of this back and forth here to show them like, hey, look, it's changed. It's changed about 0.5 millimeter there in that year and 4 months. Like that's something we need to take note of, right? Before it was just like, yeah, I mean, I think it's where it was. I don't know. I haven't seen you in 16 months, so I'm not sure. Now I know. I have data that tells me, I have numbers that tell me, and that's great for me in helping patients understand what's going on with them and getting patients to say yes to treatment if they see this kind of change. A lot of scanners now have caries detection or decay detection, specifically interproximal or in between teeth caries detection. And the iTero has this thing called NIRI, which stands for near infrared technology. And so you can see that spot there. That spot didn't show up on an X-ray, but I can see it plain as day there. That white spot on that upper, X-ray looking image there. That's decay. That's decay in between the teeth, and that's decay that needs to be treated that didn't show up on an X-ray. And when you start seeing these, you start realizing how much stuff we miss on X-rays. And so when I have a patient who comes in who's like maybe doesn't want to do X-rays, cool. Then like let me at least scan you, and I'll be able to use my caries detection technology to be able to tell what's there. And so this is going to become more and more a part of what we do and the technology we use on a daily basis. One of the things that we still use these for every day is for our simple single tooth crowns, right? And so this is a slam dunk, no brainer. You got to be able to execute this. This is just everyday dentistry. So Jerry comes in, he's got a broken distal lingual cusp on tooth number 30 with a big old amalgam. And that's just what we see every day is teeth like this with cracked cusps. He obviously has, some big silver fillings in the teeth behind that at some point we'll get into. He needs a good cleaning and whatnot. But for right now, it's this tooth. We got to prep this tooth for a single crown. So we prep it, build it up. That's what that white stuff that you see there. It's build-up material after we take out all the old silver filling, all the crack, all the decay, all the disease. We want to build the tooth back up to an ideal preparation. That's what we use that white buildup material for. That's what you're looking at there. And this is our digital scan of that tooth. Now, on that tooth, we're going to mark the margin. The margin is where the crown and the tooth meet. It's the most important part of a restoration. And so this allows us to mark the margin so that we can tell our laboratory where the margin is. So this is a different case, but this is how that technology works. You basically tell iTero, okay, mark the margin. And it uses AI technology to figure out, all right, where does the crown preparation end and where does the tooth begin? And most of the time, the AI is about 90% of the way on. It will put these little green dots around it. And then you just make any adjustments you need using the touchscreen. Every once in a while, you'll get one like this. You simply take your finger, touch that green dot, move it out to the margin where it should be. It should be kind of in that line with all the other ones. And you send that to the lab. And that gives the lab really important information that they wouldn't have had before, right? Information about where is the junction of the tooth and the crown. It's vital information that we've never been able to send to the laboratory before until now with this digital technology. So this gives the laboratory more information to work on from me directly at the time that I prepare the tooth, which is good for them. And that gives us better crowns in return, which is great for us and great for the patient. So here is our margin marked on this particular crown. So I've marked this, and now it has that red line kind of around. So that alerts the laboratory technician to where that margin is. And so on this particular one, it wasn't, there wasn't really anywhere that it was in doubt. I'm sure if I didn't mark it, the laboratory technician could have found it fine. But there are times where those margins get thin, we get deep with deep decay, things like that. And it does have some benefit to tell the laboratory where it is. And so there's our marked margin. And then we fill out the lab prescription here. We tell what kind of crown we want, what type of preparation design we have, what shade we're using from what shade system. And we send it off and we send it to the lab and they make us a crown. This is a zirconia crown, a full contour zirconia crown with the brand name of Bruxier, which is the most popular zirconia on the market, was one of the first ones to market, and is still very widely used today. So this is a zirconia crown on tooth number 30. You can see that really nice fit there, that really nice fit there. And then when you look at the x-ray, it just, apart from it looking white, which is just the x-rays not being able to pass through the zirconia, it just looks like it's part of that tooth. You don't see any junction lines between the margin and the tooth. It's just nice and smooth all the way around, just like you want it to be, just like the tooth was there before it had that big cuspal fracture. So the interesting thing about this is if you look at this, I prepped that tooth on a Friday. It was June 19th. I prepped that tooth at 8 o'clock in the morning. So I was sending it off to the lab by probably 8:40 or so. Glidewell is in Newport Beach, California, or Irvine, California, actually. Never tell anybody from Newport that they're from Irvine. They don't like that. So Glidewell is in Irvine, California. They received it. I'm in Central Time, so they received it at 6:40 a.m. their time. They had it batched. If you can see here, it says June 19th. They received it June 19th. It's in progress. And then you see there, your case is shipped on June 19th. So it literally shipped out the same day that, or it was marked to ship the same day that I sent it in. Now, that day was a Friday. They finished it at around 4 o'clock p.m. FedEx comes to Glidewell at 2 p.m. So FedEx had already left. So it didn't go out until Monday. It went out Monday, which was the 22nd. It was delivered at my office on Tuesday. So I prepped the crown on Friday morning. The lab had it finished that day. It shipped the next business day, and I got it on Tuesday. We delivered it on Wednesday. So what used to be a 2-week period, because that's just what traditionally the wait time was now less than a week, about 5 days total. And the 2-week thing is something you'll learn in dental school. There's no data to back up 2 weeks. It's just that back in the days when we were taking physical impressions and having to have those poured up and then making porcelain fused to metal crowns, where you had to cast a coping and then stack porcelain on top of them, all of those steps took 2 weeks. But now in the digital world where we prep it, they receive it a few minutes later via digital file. They can have it designed in just a few minutes. Milled, it has to center for 8 hours. But other than that, it's basically can be made and polished in a day or two, and then FedExed or dropped off to you ASAP. The day of 2 weeks is gone. And so, that makes a huge difference on how well your crowns fit. That makes a huge difference on side effects to the patient, sensitivity, things like that. Just makes everything easier on everybody the quicker you put it in. And so that's a part of what digital technology can do, is it just changes your timelines, because you're not having to wait for impression material to be poured up and for model work to be done and all that kind of stuff. They can literally receive your case and start working on it right away, which is great. And so, that's how it goes for complex or for simple cases, a single tooth, that's easy, slam dunk. But what about more complex cases? And so this is Barbara. And Barbara comes in. She obviously doesn't like her front teeth. They're overlapped. They're dark. They're stained. They're discolored. And so she wants to do porcelain veneers. And so we take a photo. We do a scan. We look at this. We decide on 8 veneers. So we're going to do veneers on her centrals, her laterals, her canines, and her premolars. We'll talk a little bit more about that later, but this will kind of give you a good idea of kind of what's possible. So there's a close-up of her teeth. And yeah, they're just dark. Those front teeth are dark. They're overlapped. She doesn't want to do orthodontics because even if we straighten them out, they're still dark, right? And so, she just doesn't like the smile that she has, right? And so we take a scan and we send that scan to the laboratory and we ask for something called the diagnostic wax up. So diagnostic wax up is where they just basically do veneers on the models, and give us a kind of a guide to go by. And then once we like that guide, that's kind of how we know we're working to it. Now we're going to prepare the teeth. And so, what you saw on Jerry's single tooth zirconia crown at number 30 is a really heavy finish line or where we prep deep into the tooth, which is what we need for a crown. But when we do veneers, we're going to prep very lightly into the tooth. Now, you can see that the prep on the central incisors right here in the middle of the tooth, or the middle two teeth, is a little bit heavier. You can see how that finish line is a little bit deeper into the tooth versus, say, the lateral incisors, right? But because those teeth are darker, I need to give the ceramist more space to be able to make a pretty veneer. And so that's why those are a little bit deeper. They're still pretty fine finish lines, and they're still finer finish lines than what you saw on the crown by far, but they're still deeper than those very, very fine finish lines that you see on the laterals, the canines, and the premolars. And so this just, it basically goes to show that, yes, this digital technology can pick up even very fine finish lines like we see on this case with these, a little deeper finish lines on the centrals, but very fine, very light finish lines on the other teeth. And this digital technology works really well. Here are her provisional restorations that we did the day of prep. This is all based on the diagnostic wax up. So that diagnostic wax up is our guide, and that's kind of where we're going to go. And so I want to build her provisionals or her temps to that guide to make sure that while the time she's in temps, they're comfortable for her. She likes them. She likes the way they look. She likes the way they feel, like the bite, all of that stuff. So we're basing that all off the diagnostic wax up. So this is literally the day we prep. The reason that our gums are kind of all beat up is because we packed retraction cord when we were prepping, we prepped, and then we made these provisionals and then we trimmed them. And so that's why, her gums all look pretty inflamed there. But that's a pretty typical deal. And these are nice temporaries. It's there are a few things that I think that I excel at, but I think I excel pretty well at making temporaries. I think my provisionals are pretty dang nice provisionals. And here's her final ceramics seated. And I think that's a really nice result. Obviously a little bit lighter than her lower teeth, but we're going to bleach her lower teeth to get them close. Never let your lower teeth drive the shade of your upper teeth. Let the upper teeth drive the shade of your lower teeth. You can always bleach the lower teeth. And if we can't bleach them as white as this, and she wants to at some point, we can, do a little Invisalign and then do 4 or 6 veneers on these lower front teeth if we wanted to. So, the upper front teeth drive everything. And so let those be your drivers. Don't let the others be the drivers. And here's our finished result. And that's, obviously to go from there to there is a I don't know, I hesitate to use the word life-changing kind of thing, but she's thrilled with this result and really confident in her smile afterwards. And for good reason, by changing the colors, getting some more uniformity there, and evening out those front teeth, it really, really changed the dynamics of her smile and even how her lips play and all of that. So, I think that was a really nice result, all digitally driven from the very start, from our discussion with her, to her treatment plan presentation, to her wax up, to the procedure itself, all the way, start to finish, all driven by digital technology in the iTero. I actually 3D print a fair amount in my office, which is fun. I enjoy that part. Because we scan every patient, anytime we need models for whatever reason, like we're going to make bleaching trays or retainers or anything like that, we just print those new patient scans, the scans we take on the patient, and we can make bleaching trays from those models. I can actually 3D print a night guard now directly and have basically take the scan, send that to a design firm. The design firm designs the night guard, sends me the design file, which I print out on my 3D printer with night guard material. We polish that up and deliver it a few days later. It saves me a bunch of money on lab fee. Patients love the night guards, and I have them turned around really fast, which is great. So 3D printing, something that you guys will probably be doing in your office at some point. I think it's, right now it's a little bleeding edge, and you just have a few weirdos like me playing with it. But more and more and more people are seeing the value in this, and I think it's going to become something that's part of everyday practice. So this is the case that really kind of changed my opinion on this whole deal. And I kind of thought maybe we were wasting time a little bit with the new patient experience iTero scan. And this was fairly early on in that process. And so I still wasn't sold on us using, 4 or 5 minutes of time during a new patient appointment for this. And this one really drove it home. So this is Katie, and Katie comes into the office, and on my new patient paperwork, I have a part that says basically why are you here? What brings you in today? What are you wanting out of your visit? And she said, and I quote, "I'm here for my free insurance cleaning." And typically speaking, when somebody says that, it means they don't want to spend any money on anything. They don't even they're only there to get their insurance to pay for their cleaning, and that's it. So they, that's typically a patient that I just look at and think okay, this isn't going to go anywhere. I'm going to, it's kind of like when you're on a date and you realize in the first 5 minutes of this date, this relationship's not going anywhere. You kind of, fake nice for the rest of that date, but then at the end of it, you just kind of move on. And that's typically how these patients go. And so I'm talking to Katie about this, oh, sure, absolutely. Yeah. You pay for your benefits. You might as well use them. Let's get you all cleaned up. And so I'm looking at her while she's talking, and I can see that her front teeth seem to be at different levels. There's some unevenness on her incisal edges of her front teeth, and the teeth look thin to me. I can kind of see some dentin or some yellow through them. And so they just look like thin teeth. And so when we do our examination, we do our scan, and I look at the scan. I'm yeah, I can kind of see that they're triangular teeth. There is some unevenness there in the incisal edges. They don't look even. And her teeth are very triangular shaped. They're very fan shaped. And so that's not the most pleasing appearance. And so, I can just tell hey, there's some stuff here. And then I look at this view and I'm okay, wow, here's what's happening. And so when you see a case like this, she has a bunch of lingual erosion on the anterior, a bunch of erosion on the lingual of her anterior teeth. And that is just what we call pathognomonic. And that basically means when you see it, it's this. It's pathognomonic with bulimia. And so this is, somebody who's creating a ton of stomach acid in their mouth from binging and purging. And, that's a very, very typical pattern that you can identify like that. And so I look at it, and Katie and I have some discussion about, hey, what her history is and whatnot. And she confesses that at a point in her life when she was younger, she was bulimic, but she's gone through therapy, she's gone through treatment, and that she's no longer doing it, but she had no idea that it had this much effect on her teeth. And she didn't think that that's what was going on with her teeth. She just thought she had ugly teeth, and that it had kind of been like this long enough since she was a teenager that she just thought that's how her teeth were. And she didn't think that the two were related. And so when you look at it in monochrome here, you can really see just how much of that tooth structure is gone from the tongue side of those top front teeth. And I show her this, and she's immediately concerned. And she says something which was obvious, but I hadn't thought of before. And she said, "I've never seen the tongue side of my top teeth." I'm oh, yeah, of course not. I mean, no one has. You can't, by definition, you can't look at them, right? Unless they get knocked out, right? You can never look at this part of your mouth. And so, yeah, I mean, we take it for granted that we get to see this on patients all the time, but they've never seen it for themselves. And so if I didn't have this to show her, and I just said hey, yeah, you've got some erosion on the backside of those front teeth. That's why they're thin or whatever. That's not nearly as powerful as showing her this, right? And showing her this image to see the level of erosion that's there and how much tooth structure is missing, right? And so now she's concerned, and now she starts asking questions well, what can we do about this? And that's on the cases like this where you have anterior wear or erosion. It's never an easy answer. The answer is almost never can you just throw some composite or filling material on it and make it better, because the way that teeth move, and teeth move as they wear down, they don't wear down all at once. It's a slow process. And they move little by little as they do wear down. And as they move, they take away your space to restore those teeth. And so wear and erosion on front teeth, really any teeth, with compensatory eruption is just really hard to deal with. And it narrows our treatment windows down considerably into a few different things. And so I start talking about that with her. You can look, this thing kind of shows me where she bites. And you can kind of see that she doesn't have she has a couple of red dots on her front teeth, and then like one tiny red dot on her back right-hand side. And so her bite is fairly even, but it's concentrated a little bit more on the interior. And that's because those teeth have erupted as they've worn down. And so, we've got to do something to make those teeth bigger. Use orthodontics to move them back to where they were and then add to the tooth as needed. I talked to Katie about this, and she just basically said, I'm not doing any orthodontics. I don't care if it's Invisalign. I don't care if it's brackets and wires. Not my thing. I don't want to wait for the year to do that. I want something now. So this is a lady that all of a sudden went from not wanting anything to wanting something today, right? Or wanting something soon. And so, okay, cool. Like, you have to respect that decision. It may not be the decision that I would make. In this case, it ended up not being a big deal because those gum lines were pretty even. But in cases where you have a big shift in that gum line one way or the other, that's orthodontics is, I think, by far my best way to handle that. The other way you can do it is called surgical crown lengthening. That's where you move the gums back. And so when you have those gums that are way down, and then as you move back, those gums jump up, simply moving the gums up surgically to where they need to be. And then you have the rest of that tooth to restore, and put a crown on or a veneer or whatever you need to add the length back to it. That can work okay. There's some disadvantages to that. There are some situations where it's the perfect thing to do. I didn't feel like it was the perfect thing for Katie because her gum lines were all fairly even. So we did some crown lengthening. I knew that her gum line in the front would be higher than her gum line in the back. And that's also unesthetic. The same way that it is the opposite way, where you have a lower gum line in the front than in the back. If you have a higher gum line in the front and it steps down to the back, also aesthetically unappealing. So surgical crown lengthening wasn't in my cards either. But so she won't let me move the teeth. Surgery isn't probably the right thing. But her teeth are still touching, even though they're all worn down on the back. And so I have to do something to create some space so that I can make those teeth the size that they need to be pretty in her face. And so that's where we go into opening the vertical dimension of occlusion, which is a really difficult concept to talk to dentists about, much less talking to a patient about it. And so I asked my assistant or my hygienist at the time, I said, give me some flowable composite. So I took some flowable composite, and you can see here on the left, on the bottom teeth, I put 2 knobs of flowable composite on her cusp tips on the second molars on each side. And then I scanned her again. So you can see that scan there. She's got just some free-handed composite there that's simply just to prove a point here. So I scanned her again, and then I showed her this. I was like, do you see what happens when I put filling material on your back teeth? And she says, yes, when you put filling material back there, it opens up space all the way around so that you have space to restore my front teeth. And I said, yep, that's exactly what we're going to do. So she was able to conceptually understand what I wanted to do, which was to add material to her back teeth to open up her vertical dimension of occlusion so that I would then have space to restore her front teeth to be pretty and in the spot they needed to be in her face and even and all of that stuff. So now she's on board with it. Now, since her lower teeth are fairly unrestored, we can do this with just composite. And so here we are, which is where we're starting. This is our diagnostic wax up that we talked about earlier. So this is kind of the guide of where I need to go. So I basically sent the lab the scans and I said, hey, add wax to these back teeth to where you have enough space to make the front teeth look pretty. And so that's what the lab tech did. And so he waxed up these back teeth until we had a nice, pretty wax up on the front. And so once we get that back, I digitize it, I scan it, and I 3D print it so that it can't be damaged, and I have a record of it. Then I make a suck down tray with our suck down machine, and I'm going to use that tray to basically do fillings on her back teeth to open her bite to the spot that we need it to go. So here we are. We've done these, quote, direct chairside composite overlays. And so these are just basically tooth by tooth. We add composite to those back teeth to the spot they need to be so that we can restore her front teeth. So here's the left side. Here is the right side when we're done. And now when you look at her bite, you can see that now we have space. Now I have space. You can see that black behind because there's nothing behind that thin enamel now, whereas what used to be behind there was her lower front teeth. But now that I've opened her up, now I have those lower front teeth up and off of that space so that we can put something back there without having to prep her teeth down, or at least the back of her front teeth down. Oh, acid already prepped the back of those front teeth down. I don't want to cut them down anymore. And so I want to add enough to her back teeth so that we have enough space so I don't have to cut the back of those down. Still got to cut the front of them down. I still have to prep those for crowns. But the back of the teeth, the tongue side, all that preparation was done by acid over years. I just have now moved her bite so that we don't have to cut that down anymore. So here we are after we've prepped the crowns. We've scanned them with our iTero, marked the margins. That's off to the lab for them to make the crowns. Here are our provisional crowns. These are pretty nicely done. Again, day that we prepped them, so her gums are pretty inflamed. I hate taking this photo. This is the temporary crowns the day we prepped them. The reason I hate taking this is because their lip is numb, and so they never give you a good smile. They end up giving you a good smile, or they end up giving you a smile like this, where it's super uneven, and their lips can't feel anything, and their lips are dried out. So this is my least favorite photo to take, but it at least shows you like those teeth are in the spot they need to be. You can see how the edges of those central incisors caress her lower lip, and in a at least the best smile I could get that day. You know, that tells me that framing wise, they're where they need to be. Here's our final porcelain crowns once they're in, and those look really, really pretty. And then here's our final smile, and we're done, right? Except I'm looking at these photos the next day as I load them in to my computer, and I think, damn it, I missed it. I missed one thing that would have made this better. And so what we did here is we gave her nice, pretty crowns in the front of her mouth that are nice and white, and we didn't do anything to the back teeth. And so it actually looks like she's missing her back teeth, right? Looks like she has 6 front teeth and no back teeth. And that's because her premolars, her first premolar, so the teeth behind the canines, are really slanted in. So she has what we call a negative buccal corridor right there. And so in her smile, that results to just black space, which looks like she's missing teeth. So I had to call her up and say, Katie, we need to add veneers to those premolars, because if we don't, it makes it look dark in the back of your mouth. And it makes me wonder if you have teeth back there at all. And so she says, send me a picture. Let me see what you're saying. So I sent her this picture, and she said, yeah, you're right. What can we do about it? And so we did a couple of veneers on those premolars. And it's such a minor thing. It doesn't seem like it's all that much, but when you look at her smile after, you can just see the difference because it's a much more full smile and it fits all the way back. Fortunately, she doesn't show too much further back than that. And so it really just took that one veneer, but this really taught me a lesson of, hey, don't forget those premolars, because those premolars can make or break something, can make or break how great the case looks. And so even though this looks good and you look at it at first like, wow, that looks good. But when you start looking at it, you're like, where are our back teeth? This looks even better, right? And so those are the things you learn when you take pictures of your cases, and you learn to sort of critically appraise your own work and understand and learn that nothing is ever going to be perfect, and we can always do little things better here and there. But we'd all love to do dentistry like that all day, but we don't get to that point unless we scan her at her new patient experience and make it a new patient experience. Give them a 360-degree tour of their mouth in 3 dimensions that they've never seen before, and show them views of things they've never seen before. That's how you get to those cases, is by doing this. And so I'm hoping that at some point, this becomes more ubiquitous. This becomes more accepted. People start understanding that these scanners are not just replacements for impression material. They are tools to get patients to say yes to treatment, but you got to use them that way. And so using these in your new patient experience and making it an experience for your patients, I think is really, really important. I think it becomes the hub of a modern dental practice, your digital scanner, whether it be iTero or one of the other, 5 or 10 other ones on the market. That's the secret to making it happen. And it's the iTero driven new patient experience. I think by the time you guys get through dental school and into practice, hopefully this is going to be commonplace, but today it's not. And if it's still not by the time you get there, make it that way for your practice. It will definitely make your practice stand out to those around you. It'll get you to do more dentistry. It will have your patients accept treatment plans more often and with more regularity. And it will make you faster, easier, and better. I think our patients deserve it. I think we deserve it. It has done huge things for my practice. It has changed my revenue by 26%. Just this. So doing nothing more than scanning new patients at their hygiene visit has raised my revenue by 26%. So I think that's a pretty spectacular return on investment. And I think about this room, this operatory that my dad did dentistry in for 25 years, right? And how dated and ancient it looks right now. But if you add this in the corner of it, it's a modern dental practice, right? It doesn't take overhauling everything. It just takes adding the right thing. And for me and for my practice, it was adding an iTero scanner. But I think there's plenty of other scanners on the market that can do a similar job. I just think it's a matter of getting it and using it and doing it and showing new patients what they have, what's happening, what you can do for them, and it will change your practice. You guys can reach me anytime by email, jaustindds@me.com. You can reach me anywhere on social media at Joshua Austin DDS. Except for Snapchat or TikTok, because I'm 42 years old, and any 42-year-old man that's on Snapchat or TikTok has, I'm just going to say it, they have ulterior motives. That's all. I'm not going to throw anybody under the bus. I'm not going to say anything nasty about anybody, but I just question any 42-year-old man who's like hanging out a ton on Snapchat or TikTok. That's all I'm saying. Do we have any questions?
Dr. Austin, can you hear me clearly?
I can.
Wonderful. So we actually encountered a brief technical issue, so I'll have to continue the talk or the presentation with my camera off. But I want to say that, first of all, on behalf of our team and today's attendees, that was an incredible presentation. And that last case was particularly powerful. If you noticed me looking away during the presentation, I was actually taking a few notes, and you mentioned some pretty awesome themes, the value of patient-physician transparency, the value of using technology to better serve the patient, and basically how that can empower a patient to take ownership of their oral health. And just going back to the initial images that you shared, I have to say that they were incredible. I think they have to be archived for posterity. But my first question is, you mentioned that your father was actually a practicing dentist, and I'm sure that he provided you with a wealth of insight. But what do you wish you had known about dentistry before you entered it? Do you have any advice that you'd like to share?
Yeah, I made a little allusion to it earlier. It's like, it's not selling ice cream, right? And I think a lot of times the personality types that lead people to dentistry have some similarities and some crossovers, right? So there are some, not to say that every dentist is exactly the same personality wise, but there are just some traits that you see a lot in dentistry that you don't see in other places. And one of those is being people pleaser. It's like, you just want to be a people pleaser. Like everybody goes to dental school is like, I want to be the cool dentist. I want to be the dentist that, patients aren't afraid of. I want I want patients to feel comfortable. I want my injections not to hurt, all that kind of stuff. Right. And, you go in with a people pleasing attitude, and what you realize is just like in dentistry, you're not going to make everybody happy. And if you want to make everybody happy, like, go sell ice cream, right? Because that's like the only thing that will make everybody happy. And so I think just learning that, like, hey, not everyone's always going to be happy, and that's okay. And generally speaking, when someone gets upset with a dentist, it's almost always about insurance. It's like 90% of the time it's about insurance. It's not about like the margin on a crown, or it's not about, a broken tooth or anything like that. It's always that, like, we expected the insurance to pay $170. They paid $105. The patient owes an additional $65 and they're pissed, right? It's always that. And so, I think you have to understand that not everyone's going to be happy all the time. You can't make everyone happy, and you'll go crazy trying to. So that's one thing to understand. I think the second thing would be that this job's hard on our bodies. And so this sounds like incredibly egotistical and wild, but and I didn't really believe it at first as I was younger, and I just never hurt. But as you get older in dentistry, like your body starts to hurt. And you realize that you just have to start treating your body like a professional athlete does. And no, like, I don't mean like you need to be like LeBron James and, go get HGH injections into your knee and like, live in a hyperbaric chamber and that kind of stuff. But I just mean like stretching, yoga, trying to stay in shape, doing some weight training, doing some cardio work, doing those kind of things to take care of your body. I see a physical therapist every month, whether I need it or not, to just kind of keep me aligned and keep me in shape. And there's days that I hurt, there's days when I get home and my back hurts or my neck hurts, or for some reason my leg hurts, God knows why. And as you get older in dentistry, your body just starts to hurt. And so, I think making sure that you stay on top of that and are cognizant of the positions you put your body in and the way you treat your body, I think makes a difference in your career. And I know people who treat their body very well and still have issues, right? And I just think like, what if they didn't treat their body well? They wouldn't be practicing. And so at some point in every dentist career, you're going to have some pain, whether it be back pain, neck pain, shoulder pain, something like that. Something's going to hurt. And so the better you are about taking care of that, I think the better, your career will be, the more pain-free your career will be, and the more profitable your career will be, because you just can't be super profitable if you're hurting all the time.
Right. Absolutely. Yeah, definitely. And a few important considerations. I guess our next question would be, I guess I'll preface it by saying we have a large pre-dental audience, many of whom are applying to dental school, but many of those who are currently in dental school. So as someone who's successfully navigated, I guess, the pre-dental path, what kind of activities did you do in undergrad that helped you prepare for dental school?
Yeah. I definitely think join whatever pre-dental society is on the campus of where you are, or whatever school you're at, whether that be, even if there isn't a specific pre-dental organization, if there's a health professional, whatever it may be, like get involved at that level. If there's a pre-dental council, committee, whatever club, join that, be active in it. They absolutely look at that. The admissions officers absolutely look at that. It seems as time has gone by and applications have gone up, numbers of applications have gone up, it has become fairly formulaic for most of these committees, these admissions committees, and the formula being, overall GPA, science GPA, DAT, and all the schools kind of vary on how they do that, but they have some sort of numerical formula that they put together on those. That's the weight of your point system. And then, then you have your interview, your essay, other activities, things like that. And so, you could be a stud in the president of the pre-dental club. You can volunteer everywhere. You can have worked everywhere. But like, if you have a 2.25 and got a 15 on the DAT, like it just ain't happening. It's a numbers game. You can't make up for that. So I think you have to pay some attention to your numbers. I'm not saying, sacrifice every part of your life to get a 4.0. You obviously live life in college, have fun, do the things you want to do, but just be cognizant of what your numbers are. The better you do on the DAT, the far better chances you have of getting in. My wife's a dentist. She got a 27 on the DAT. I don't know if it's scored the same way that it now that it was when I took it, but when I took it and when she took it, a 27 meant like you missed one or two questions. It's wild. It's she was like turned into Michael Jordan for that day.
Yeah, that's a mythical level.
It's a monster number. It's a monster number. So she had schools like calling her and like offering her money to come to dental school. It's unheard of. If you can put up a huge number, like it just changes the whole game. I hate to say it, but put as much work into that as you can, because that makes a huge difference. But on a non-numerical level, I mean, yeah, being involved in all that stuff, either working or volunteering in some capacity, either with a local dental society and their charity events, or a local dentist office, and any of those kind of charitable dentistry events that get run around through organized dentistry at different parts around the country. All those things are amazing things. You get seen at those things. You meet people at those things. People are on faculty. Those are the kinds of relationships that you meet, and that you can grow from doing things like that. That, if you're just stuck inside studying all day, it just ain't going to happen. And so I think it's a balance of those two things, of being active, being involved on a campus level in the dental community of wherever you're at, and then, putting some attention and focus on grades and obviously DAT score.
Sure, absolutely. We have another question submitted by Andy. And this question relates sort of to being a financially savvy practice owner. His question reads, what type of competition do you see in the future for digital scanners? What should future practice owners pay close attention to when wanting the best instruments/tools for the right price?
Yeah. So that, when you get into technology, it's the same thing we have with our phones and our computers, right? Is that you buy something and it's the latest and greatest, and it seems like 3 weeks later, like something new comes out, and that's, you just get into that, that chase mode with that. And so that can be difficult, right? And so you have to have some, patience and some willingness and ability to say no as far as buying, just the latest and greatest all the time. Because these things are, it's not like, I don't know, you buy a new iPhone and what is it, $1,000? Like, I'm not saying it's cheap, but it's also like, it's not going to bankrupt you for the most part. But like these scanners can be upwards of 50 grand, right? And so if you're just dropping 50 on one of these, like every time one comes out, like you just end up with a closet, a storage unit full of unused ones and money that's gone down the drain. And so I think where it's at today, I think, it's hard to dictate where it's going to be in the future, because I don't know like where the FTC, the Federal Trade Commission gets involved. Like as of right now, if you want to do Invisalign, the only way that you can work in that Invisalign ecosystem is if you have an iTero. If you have any other scanner, they won't accept it with Invisalign. And so all the other scanners have their own clear aligner system, but Invisalign is sort of the one that patients know by name. They have the most, they have the best software. They have the most data. So they can predictably, I think, move teeth better than other companies can. And so if you want to play in that ecosystem, you kind of have to get the iTero. I think that's where things are if there's going to be a change and there's going to be something that really shakes up the industry, it's going to come with like an FTC ruling that Align Technology can't do that anymore. And if that happens, it's really going to change the ball game, because it's going to mean that these guys all have to compete, and it's going to lower costs on everything. I think what I tell dentists right now is like, hey, do you want to do Invisalign? That's the first question. That's like the first yes or no. If the answer is yes, then it's iTero. If the answer is no, then it goes off from there on basically like what you want to use it for. And I would predict that it's going to kind of be like that as time goes on. There's going to be some scanners that are stronger for one thing than another thing. And so it all depends on what you want to use it for. I have a friend who's a prosthodontist in Boston, and she really makes a lot of dentures. And so she wanted a scanner that had a bunch of robust denture workflow. And the iTero doesn't really have that much denture workflow. There is some that can be done, but it's kind of workaround, and it's not really designed for that. And so she went with what's called a 3Shape, which is a much more prosthodontic heavy scanner. And that's what's right for her practice. And so what's right for her isn't necessarily what's right for me. And so I think what I would hesitate to get away from is like trying to always have the best, always have the latest and greatest. Because honestly, like I could have an iTero from 3 iTeros ago and still be successful with it today. It's, it might take me an extra minute to get a scan, that kind of stuff. But by and large, I can still do the same stuff with that as I can with the brand new ones that I have. And so never overextend yourself on them. I'm a huge advocate of like, especially early on in your practice, buying a used one. Like I sold my iTero Element 2 on eBay a couple weeks ago. Whoever bought it is a dentist in Colorado who's opening his own practice. Got a hell of a deal on it. Got a great deal on it. He got it for cheap. And so he's going to be great. He's going to be successful with it. And so that's sort of how I did it. I bought one, sort of found the ecosystem I wanted, bought one, used it by itself for a long time. We wheeled it around from room to room to room. And then as profits went up and as I became more financially free to be able to buy a second one, we bought a second one and then a third one. And then it's off and going from there. So I think it's depending on when you get into the market, it's figuring out what you want to use it for and then making the decision based on that. And then going from there, starting small, building it up, and then adding more benefits, more features and all that stuff as you have the financial freedom to be able to do that.
Absolutely. Thank you for sharing. I guess our next question would be, which it sort of echoes a similar sentiment of managing a practice effectively. So a common gripe that a lot of dental students espouse is that the current dental curriculum doesn't necessarily focus on the business aspects of dentistry. For those students who have that grudge, would you have any other sort of insight or advice that you'd like to share on being able to successfully navigate a practice down the line?
We had that same complaint when I was in dental school, and I was looking back not long ago at like our course, like what courses we had what semester. And we had dental practice management pretty much every semester, or at least every year, one of the semesters, fall or spring, we would have practice management. And I like flipped back to my notes from like freshman year practice management, and they were like so half-assed, like there's hardly any notes. And I remember basically what happened is like, they're teaching us this practice management stuff. And I'm like, that stuff's 3.5 years away. Like I have a gross anatomy exam next week. That's what I care about right now. Right. And so I think dental schools probably at some point tried, to teach more practice management and teach it earlier. But dental students are just sort of conditioned to be like, what's the next test? And let me get through the next test, right? And so, there's not a great time to put it. I mean, ideally, like when you would do it would be like the fall semester and the spring semester of senior year and have nothing else but that and then like clinic and have no other lectures or whatever, right? And just have all your other lectures you do before that in dental school. And then senior year, it's like just clinic and practice management. That would be ideal. But that's just probably never going to happen, just logistically. So no matter what, dental schools are going to kind of get thrown into the bus afterwards because they didn't teach us any of this stuff. And it's like, yeah, well, they probably tried, but most of the dental students didn't pay attention because they had a gross anatomy exam the next week. And so you're forced to then, crash course it when you get out and work for somebody else and hope you work for somebody who knows what they're doing and can teach you some business things. And maybe you buy into a practice that has good business practices or whatnot. Or you start up and get a consultant and yada, yada, yada. I think the good news is that there's a ton of really good consultants that have online stuff. There's one in particular, like if you're really into the idea of starting up a practice when you graduate, there's this guy named Scott Luna, and it's spelled funny. It's Leune, who has something called Breakaway Practice Seminars, which is incredibly popular to teach people the systems they need to start up a practice. He gives dental student discounts. It makes his courses super cheap. They're pretty much all online and all virtual now. So you could do them, Saturdays, Sundays, modular, whenever you want, nights, evenings, whatever. So if you're into that like business stuff, you can do it that way. And the reason I know is because Scott was a year ahead of me in dental school at San Antonio. And he was doing all that stuff at nights and weekends, all off a website called Dental Town, which still exists, but it's not what it used to be. It used to be this like monster. It used to be like Reddit, but for dentistry. And it had a ton of activity and whatnot. And he just like went to business school on Dental Town every day. And learned all this stuff and put it together, started up a practice like literally 3 months after he graduated, crushed it immediately, opened up another one, crushed it, has opened probably 50 practices over the years, opened them, built them up, sold them, has done the same thing with DSOs, opened DSOs, built them up, sold them. And now he basically just teaches these systems that he uses. And so there's plenty of people out there. There's Scott Luna, there's Mark Costes, Costes. There's Craig Spodak and Bulletproof Dental Seminars. So there's a bunch of these out there. Almost all of them will give you a damn near complimentary admission, if not super cheap, so that you can get that information out there if you want. that's how I would go about it. I think what you're going to learn from guys like Scott or guys like Costas or Spodak is going to be far more valuable than any practice management lecture in dental school can give you, just because it's like, they know that most of the people in the class don't care. They're just trying to survive the day, get to the next test, whatever. And so just start looking for that outside information from those guys who are experts. They share it openly and willingly with dental students for a very low cost. I think you can get some great information on that before you graduate, so that when you do graduate, you're ready to go. Maybe not necessarily you start a practice right away, but you're at least a better employee. You understand more. You're looking out for more different things. You're kind of more willing and engaged in the practice that you go into. It will make you ready for practice ownership sooner than you would be otherwise if you just, didn't get involved in taking those kind of courses. So at the end of the day, to me, it all comes down to CE. And that's kind of the way it is true with everything. And there's not much that you learn in dental school that where you're like ready to roll when you get out of school. It all comes down to like continuing education and how you better yourself after you graduate. There's people that I went to dental school with that have done nothing really remarkably continuing education wise. They're still doing everything the same way as we learned in dental school 16 years ago. And I think that's a problem. And then there's, other people that are kind of like me and the people that I run around with, that there's really nothing that I do today that's anything like I did in dental school. It's almost all different. I think giving an injection is about the only thing I do the same way today that I did when I was in dental school. Other than that, everything's changed, so you just have to always stay constantly learning, constantly going to courses, constantly learning new things, expanding your skills, making yourself uncomfortable in that arena so that you're not uncomfortable in the operatory is basically what it comes down to.
Incredible. Yeah. So to that student, basically the onus is on you. So if you're interested, take the initiative, do your research, and take advantage of any available resources. An additional question, Stephanie here asks, what led you to choosing restorative and cosmetic dentistry as opposed to other specialties such as orthodontistry, where you mentioned it is more cushiony?
Well, so it's always interesting. People who want to do ortho know they want to do ortho before they go to dental school. And that's mainly and it's always like 20 people of every dental school class that insist they're going to be an orthodontist. And the main reason is because like as a 20-year-old dental student or 21-year-old dental student, that's pretty much the only dental experience you have. Is like, oh, I got braces when I was a teenager and my orthodontist was pretty cool, so I want to do that. And then like you go to your first ortho lecture and you're just like, oh my God, this is awful. But there's still like 10 people that have convinced themselves they're going to be orthodontists. So they push themselves through it and they deal with it. And then finally the orthodontic people are like, okay, these are the good guys. We'll let them in. And then they teach them real orthodontics, and they don't teach, pre-docs really any orthodontics that are of any value at all. So they're the only specialty that kind of treat things like that. I really thought I wanted to be a periodontist actually. And I went into dental school saying kind of open, like, I kind of want to see what I like. And I ended up really liking perio. And so I distinctly remember, standing outside of the director of perio's office, with my application for perio my senior year, and looking at the slot, and like, I had the envelope in my hand and thinking like, should I apply? Should I not apply? Should I do this? If I put this envelope in there and I get in, I don't think I'm going to be able to turn it down. And I remember thinking like, if I do this, I might never get to prep a crown again. And for some reason that just like, I just couldn't, it's just, that was the one thing that I really loved more than anything else. And so that's sort of just what made me put that application away, and I never turned it in. And I've actually become pretty good friends with that person who was the residency director of perio at that time at my school. And he has kind of told me like, yeah, you would have gotten in, not because you're just an amazing candidate, but we pretty much let in somebody that went to this dental school every year and nobody else applied that year. So you would have gotten in. And so I just wonder like how my career would be different if I did it. I tell everybody who goes into dental school, just have an open mind. You may really think you want to be an orthodontist, but if you find that you like something better, like don't be afraid to follow that. And so for me, it was crown preps. Like I just love prepping crowns. There's nothing I love more than sitting down and having, 15, 20 minutes to be able to prep a crown and just put the nicest finish line I can on. And I just enjoy it. I never get tired of it. I never get tired of prepping a single unit crown or 2 crowns or 3 crowns or 10 crowns, whatever it is, I just never get tired of it. So that's what it was for me. And so just follow whatever it is you like that. If it is ortho, great, do ortho. If it's endo and root canals, do endo. Do everything you can to meet the people in the endo department and do as many endos as you can. If it's pros, do that, whatever it may be, whatever it ends up that you really like in dental school, listen to that, because this job is hard. And if you hate everything you do about it, it's going to be hard no matter what. If you're an orthodontist, there's parts about ortho that you don't like. If you're an endodontist, there's parts about endo you don't like. There's parts of any job that you're not going to like. But what you really want is for at least the main thing that you do or something you do often to be something you really like, that really stimulates you and really keeps you going. And for me, that was crown preps. And so that's what pushed me that way. And for other people, it may not be. It's whatever it is that you find that you like, whether it be implants or surgery or endo or pedo, love being around kids, whatever it may be, listen to whatever that little voice is, and then do everything you can to do more of that, whatever it ends up being. Absolutely.
Thank you for sharing. Before we do conclude today's session, I think we have enough time for one additional question. A viewer submits, how are you able to finance your practice? In addition, how are you able to get clientele? I understand this might be a sort of a deep question, but feel free to go in.
I can do it pretty quick. As far as financing goes, for the most part, a dentist is a pretty sure bet for a bank. If a dentist stays clean on drugs, doesn't sleep with their staff, for the most part, they're probably going to be okay, by and large. And so dentists rarely default on loans. And so most banks pretty willingly loan dentists money without too much of a problem. Most of them have a healthcare division in their bank, and they know all, have pretty standard terms and things like that. And so getting money for a practice isn't that big of a deal. It's probably a little different today than it was in 2007 when I started the process. Although we went through a pretty major financial collapse in 2008 that changed things up a little bit. But for the most part, you can probably still get a loan. It's not going to be that big of a deal. It'll be fine. Are you going to have to personally sign for it? Yeah, absolutely. But if you've got a loan for a car or a mortgage or whatever, you're personally signing for it, right? You're the guarantor on it. So yeah, it's no different than that. It's part of the deal. As far as getting new patients goes, there's a few different ways to look at it. You can, spend a bunch of money on marketing, which I didn't have the luxury to do. You can sign up for every insurance plan in the world, which I didn't necessarily want to do. Or you could strategically use the internet to market well. And that's really what I did. And I happened to kind of start my practice at the time that sort of Google reviews and Yelp reviews and review culture was coming online. And so what I noticed was that my phone rang more after we got a Google review the next day. It was as granular and anecdotal as that. And so we just started making a push to get more Google reviews. And that really helped me grow my practice. And it's to the point now where I don't really pay for any advertising. It's just my Google and Yelp reviews. And pretty much every new patient I get is either from Google or Yelp or a personal, recommendation by a friend or colleague or whatever, or friend, loved one, family member of someone who's already a patient. And so, to me, that's kind of the best way to do it. Using the internet, whether it be Instagram, whether it be a YouTube channel, there's just lots of different creative ways to get your message out there. And do so in a way that's inexpensive. And so I think growing your practice, for the most part, if you can be in a somewhat visible spot and can use the internet at all, and have a little bit of time to set up all your profiles and do all that kind of stuff, I think you can grow practice with no problem. So I think, spending a lot of money on things like direct mail and magazine ads and stuff like that, probably not a great idea. But if you have a little bit of time and a little bit of internet savvy, I think you can utilize all those different channels today to get your voice out there and get patients coming in. And I think that's, at the end of the day, that's, what it all comes down to.
Fantastic. Well, Dr. Austin, on that note, we'll go ahead and conclude today's session. Thank you so much for providing or for sharing with us a wealth of insight. We really appreciate your time. And we'd like to wish you a productive year. Thank you so much again.
Thank you, guys. And like I said, I'm always around. You guys have any questions, whatever, just hit me up on socials, mainly Instagram @Joshua Austin DDS. But you guys are great. Thank you so much. I really appreciate it.